Which electrolyte is the major intracellular cation? Answer is potassium. Normal adult pulse rate is 60 to 100 per minute. The most common cause of myocardial infarction is coronary artery blockage. Which drug is commonly used for angina? Nitroglycerin. Normal adult respiratory rate is 12 to 20 per minute. Which organ is mainly affected in hepatitis? Liver. Diabetes mellitus is characterized by high blood sugar. Insulin is produced by pancreas. COPD primarily affects lungs, which is a symptom of hypoglycemia. Sweating. Normal body temperature is 36.5 to 37.5 degrees Celsius. Which vitamin deficiency causes scurvy? Vitamin C. Which disease causes butterfly rash? Systemic lupus erythematosus. Normal hemoglobin level in adult females is 12 to 16 GDL. Which condition requires dialysis? Kidney failure. ECG is used to assess heart. Which electrolyte is important for blood clotting? Calcium. Gastric ulcer commonly causes epigastric pain. The normal blood pH is 7.35 to 7.45. Which hormone regulates blood calcium? Parathyroid hormone. Hypertension is BP above 140/90 millimeters of mercury. Which disease is caused by uric acid crystal deposition? Gout. Which position improves breathing? Fowler's. Which blood group is the universal donor? O negative. Which blood group is the universal recipient? AB positive. Which test measures long-term glucose control? HbA1c. Which vitamin deficiency causes rickets? Vitamin D. Which disease is caused by Mycobacterium tuberculosis? Tuberculosis. Which artery is commonly used to measure pulse? Radial. Normal oxygen saturation is 95 to 100%. Which disease causes excessive thirst? Diabetes mellitus. Which organ stores bile? Gallbladder. Which vitamin is essential for blood clotting? Vitamin K. Which condition causes enlarged thyroid gland? Goiter. Which is the antidote for heparin? Protamine sulfate. Which disease causes chronic airflow obstruction? COPD. Which electrolyte imbalance causes muscle weakness? Hypokalemia. Which insulin acts rapidly? Lispro. Normal platelet count is 150,000 to 450,000 per cubic millimeter. Which disease causes pitting edema? Heart failure. Which chamber pumps blood to the body? Left ventricle. Which test evaluates kidney function? Serum creatinine. Which disease is associated with wheezing? Asthma. Which medication is a loop diuretic? Furosemide. Which condition causes yellow discoloration of skin? Jaundice. Which diet is recommended for hypertension? DASH diet. Which vitamin deficiency causes pernicious anemia? Vitamin B12. Which is the first priority in CPR? Circulation chest compressions. Which infection control precaution is used for pulmonary tuberculosis? Airborne precautions. Which laboratory test measures oxygen and carbon dioxide levels in blood? ABG. Thanks for watching. Like, share, and subscribe for more videos.